Welcome back. This is Matthew McKenzie, carer, activist, uh, care champion and advocate. Run many carer groups, and if you've checked out my blog, which I'll put in the video description, I tend to promote and raise awareness of those who are caring for someone with long-term ill health. So as you can tell by this lecture, and I'll try and make it short, although I probably will fail doing that. We're going to be looking at effective negotiation skills when you're working or trying to deal with healthcare providers. And all this is a guide for caregivers. I do want to sort of stress this is unpaid carers, not care workers. And the main reason for why I felt I had to sort of do this particular lecture is the biggest thing is that carers are not really trained to do that role. Um, And don't get me wrong, when their loved one or the person that they're caring for going through long-term illnesses, struggling, you know, you can feel many carers have some form of negotiation because they want to see the best for their loved ones, want to see the better outcomes. The problem tends to happen though when things are not going so well and you eventually begin to lose your rag, basically. It can be so easy to get angry, shout, and the outcomes, unfortunately, may suffer because of that, the outcomes of the person that you're caring for. So anyway, I want to get into particular tips, strategies, skills that I feel caregivers can use to help them work together as a team with healthcare professionals. But before I begin, as usual, I need subscribers. So if you like the content, if you feel this video is useful for you and you're looking for more information about caring for someone or stuff that you've not come across before that you feel is useful, do subscribe to my channel. Give this video a like. I want to share knowledge as far as I can, to be honest. I do feel those out there caring for someone need all the help and information they can get. And to be honest, I'm not right about everything. You pick and choose what you feel is useful for you. But to do that, I'd like you to subscribe so not to miss any future content. So when it comes to developing effective negotiation skills, you're not really told how to do this. Basically, the only thing you're more likely to be told is that you might be told that you are a carer. You might be told about specific services, whether it's mental health services or physical health services. But the buck stops there, really, on how you negotiate on the outcomes you want to see. And I'm not saying that all carers are going to be correct on what they negotiate for. There are things they might need to have a think about. They might need to listen to what the professional is saying. After all, they are the professional. Although, don't get me wrong, the carer may spend a lot more time with the person that they're caring for. But what we want to avoid is the situation you see in this picture, where the carer has lost their rag, they've lost their temper, and the social worker, care coordinator, nurse, health professional is also lost their rag. And to be honest, things just take a turn for the worst. The outcomes for the patient might decline, or they don't want to work with yourselves anymore. Services put up barriers, you put up barriers. And this is not the best way to deal with things, to be honest. So developing a strong negotiation skills with healthcare staff, healthcare professionals, I feel it's essential for carers. I've been running care groups for a long time. I've been involved in a lot of mental health trusts. I still am. and that care support groups. And I see this quite often. I see carers shout at me, they might shout at other carers. And I'm not saying they don't need help because they don't need help. They do. And it might be that there might be it failed by services and it's caused an impact on that carer's well-being. But on the other side of this is it does no one any good. It really doesn't. You're fighting a battle, basically, that is distracting, to be honest. It's a waste of time, waste of energy. When the main focus is the care and support for your loved one, that's where the energy should be going. That's where negotiation, effective negotiation, is of value. So, what we want, and I'm sure what everyone wants, is that the care recipient receives the best possible support and services. Don't waste time shouting and arguing and blaming. I mean, obviously, I want carers to complain if they feel hard done by. That's very important. What is no good is arguments and conflict. Those are not helpful. So, negotiating effectively can actually help carers advocate for their loved one. This is the goal, this is the aim that I feel families, friends, and carers need to work towards. Resources are scarce, resources are fleeting, and they're not always going to be available for everyone. So if you can negotiate, and to go for this lecture, go for the blog, do so because you want to secure those resources. If you don't, then another carer who's learned how to negotiate will get those resources for their loved one while you're standing there shouting, which is a waste of time and a waste of energy. Put that energy into negotiation, and I'll explain more on this in the lecture. You want to build a collaborative relationship with healthcare professionals. And I'm not saying it's going to be 100%. There'll be situations where things break down. That's just being realistic. But there are tools that every carer can use, and there are lots of them. Don't ignore them. They're there to help you. So I'm going to give you a step-by-step guide for carers to enhance your negotiation skills. So let's begin. So building knowledge and confidence, and you can see from this picture what this care is doing. There might be a community mental health team, and I'm going to assume again the focus is on those caring for someone living with mental illness. So the very first thing regarding your role as a carer is you've got to really understand what the cared for's needs are. You've got to understand what you're dealing with, what the illness is, what the diagnosis is. The more you know about that, the more you can plan and prepare for what the cared for needs in the future or what they need for now. Learn about your loved one's medical conditions. Knowledge is useful. If you have that medical condition information, then you can work towards negotiating what treatment options are available and what care requirements will be needed. Those are the very first things you should really try and get to grips with, knowing what you're trying to care for. Next thing is keeping records of their health history, obviously with consent. But I'm assuming you have consent, and it's going to be touch and go. Sometimes consent will go, sometimes it'll come back. It's all about securing that relationship with your loved one, with the person that's going through mental illness. If you can't keep records of their health history, then you have to negotiate with your loved one to just make sure that they keep records of their own health history. If there are no records, this is when things get really difficult. But if you both can keep records of that health history, keep records of the medications and any concerns to present during any future discussions, you're off to a good start. So the first thing is building up that knowledge, because when you have the knowledge, you have the confidence in knowing what to ask for. This is really difficult. I don't think this is easy, to be honest, because I do feel the mental health system is very complex and almost ever changing. But it shouldn't stop you trying to familiarize yourself with the healthcare system, whether it's acute, physical, or mental health. Understanding the healthcare system, how it works, including any insurance that you might need to be coverage on, available services, and eligibility criteria. I also need to research alternatives, and it's not unheard of. Sometimes you're offered a range of treatment options that you feel won't do any good, and that's why I put down medication. The when it comes to mental health, a lot of alternatives carers might ask for is look forms of talking therapy, psychological therapies. If not, if you can't avoid the medication, then you want um, psychological therapies going with that medication. It's not just medicate and good luck. So look at different alternatives, different forms of care settings, so that you can confidently discuss and request alternatives if needed. And alternatives are there. Um, as I said, look at those care plans. Is it all set in stone? I don't think so. This is when you're going to be wanting to negotiate what is going to be the better outcome. I've learned from my experience that when I was caring for my loved one, my mum, I just took those words at gospel. And I felt her health did deteriorate because I wasn't really challenging as much as I should do, but it was very difficult because I felt over the years, my mum did not have the awareness or insight to cope with her own health needs, even though that's very important. You want them to be independent and you want your loved one to be empowered to do so. It's really difficult if the mental illness is clouding specific judgment. So the onus really partly is on the family and carers who are trying to support their loved ones. So don't just jump into a meeting that you've been invited to without any preparation. That's one of the reasons why I've mentioned understand the diagnosis, have those records. In fact, even better, you might want to take the trip to your local care center or to an advocate and go through what you need to prepare for. Hence, identifying what you want to achieve out of those meetings, whether it's a ward round or a care plan approach in regards to outcomes or planning the care for your loved one and what your role is. Any additional support services, or even if you want better communication with those providing mental health services. As I mentioned already, gather those relevant records, go through them again, um, one more time, even to know that maybe you don't want to miss anything, any evidence that supports your case. And a good example is side effects of medication. You've been invited back to a care planning meeting, and it's good. They want to hear, what you've noticed about the medication. So obviously, you're going to negotiate if there's a better form of medication. You want to hear more information about it, whether it's working, what the side effects are causing, symptoms. It's up to yourself to um, prepare by looking at those documentation. Without looking at the documentation, it's hard to negotiate what you want. And this is just being realistic, to be honest. The world as it is not it's not perfect. There's lots of ups and downs. So do consider barriers. Most of the time, health professionals are not going to be there to argue. They don't want to do that. They want to reach the same conclusion as yourself, better outcomes for the patients. But there will be, unfortunately, objections. There will be barriers, there'll be challenges from the provider. They know what they're doing. Most of the time, they do. And in your role, you're not sure what you're going to be dealing with. You might educate yourself, and over the years, you will know just as much in some sense. But there might be a clash of opinions. And I just tend to expect that. That's why I've mentioned negotiations will start coming into play when things like this happen. So think to yourself, what could the professional or social worker or care coordinator say to you that will think, oh, hang on a second, I'm not really sure I want that as an outcome, or I don't want to accept that opinion. I'm gonna try and see if there's an alternative, or prepare my response to, or compromise. So communicating effectively is a criticism of the NHS. Really, is jargon, but that doesn't mean carers can't come up with their own forms of jargon. Remember, your loved one's health is on the line. So if you want to get things across clear, express your concerns in a straightforward manner. Remember, no shouting or intimidating. Avoid that jargon as well, or over the emotional appeals. It's not going to work, and I personally think it's a waste of time. I do expect at times emotions get the better of us. We're human, and when we're seeing our loved ones suffer, then of course I understand there'll be times when we get frustrated and lash out. But I'm giving you tips here. So I'm giving an example, Look, I've noticed increased confusion since any medication change that's been prescribed. Can we explore alternative treatments? And remember all the stuff I've been saying before. When it comes to medication, you're looking at the side effects. I've mentioned about alternative options. Don't just sort of take what's given, because they are there. And I've mentioned you're asking that question. You've noticed something. You've been asked to come to a care plan meeting, and I think that's good news. But don't waste that opportunity. And these sort of questions, when it comes to negotiation, they can be open-ended. You don't have to be demanding. You want to encourage that dialogue, like, you know, what other options are available, and in a calm manner, and how can we make this treatment more effective? So you're not sort of stuck, and you're sort of trying to work with the health professional. Obviously, the patient, if wish, can ask these same things, even better if it's coming from them. Again, we've got that one. Again, we're looking at being assertive, but also being respectful, not sort of shouting and calling names. You want to be firm in what you want for your loved one's needs while maintaining, a collaborative tone. You want to work with them. You want to be part of that team. You could mention, look, I understand your recommendation, but I'm concerned about the impact to my loved one's mobility. That's just an example there. Medication perhaps has added more weight, and the cared for can't move as much as they would. And in the future, it's going to impact their health negatively. So again, you're looking for alternatives. It's all about collaboration, as I mentioned before. It's about adopting that team approach. You are actually part of that team, whether, healthcare professionals sort of say, no, that's not the case. You are part of that triangle. So here you want to emphasize that you and the health professional share the same goal for your loved one's well-being. So you're being respectful. You could say to them, look, I value your expertise, and I like to work together to find the best solution. And you want to acknowledge their perspective as well. That it's their job. Show that you're trying to understand, their constraints, whether it's time limits, other restrictions. It doesn't have to be insurance. Well, advocating for your loved one's needs, and you know, even there might be situations where there is no alternative, but you might try and compromise. If your preferred solution isn't possible, work with the provider, and what I mean by provider is healthcare professional, to identify any other acceptable alternatives. So even if it's the thing you ask for that can't be provided, maybe there might be something else in the meantime. It's a bit of give and take. That's what I'm trying to say. So advocating assertively. So there might be situations where you'll have to stand firm. If you feel that your loved one's needs aren't being met, politely but firmly insist on further discussion or clarification. Now, I should have put clarification in bold on this one, because there's things that can be met, can be raised at such a meeting, and there isn't enough time, and decisions made are very important. They will impact your loved one's life. They'll impact your life. So it doesn't hurt to ask for clarification. What do they really mean? Going away from that, if you feel that this plan doesn't fully address your loved one's need on pain management, can we get a second opinion from another doctor or consultant psychiatrist? Can we consult a particular specialist, pharmacist, um, nutrition expert, um, social provider even? There's quite a few. And I've mentioned, because I've jumped, we mentioned second opinion. If you're not satisfied with the psychiatrist's recommendation or the mental health professional recommendation, then it doesn't hurt to seek another perspective from a different healthcare professional. And the reason I've mentioned this is it's very important. If you keep seeing a decline in loved one's health and the medications just aren't, is not working, you just keep seeing these side effects. There's weight gains, there's shaking, there's drooling. So you're gonna just say, listen, I respect your opinion. I respect, what you're consulting regarding my loved one's mental health. I now request a second opinion. It's your right. It's the patient's right for a second opinion. And you never know, that opinion might be beneficial, or unfortunately, it might end up being the same as the first opinion, the first suggestion from the health professional. And I've just mentioned rights. It is within the realm of your carer's rights. You have to familiarize yourself with the person's rights or your carer's rights, um, to ensure fair treatment and access to resources. As I mentioned, resources are now scarce within mental health services, but that if you negotiate, you're more likely to get them. So building relationships with the health professionals. Maintain to be open. What I mean by that is if they want to contact you, just say, listen, perhaps email, perhaps phone, this is the time I can be contacted. Be respectful in communication. Just it takes a long time, to be honest. If you're new to the caring role, then obviously you're in a whirlwind. You're just not sure who to trust. You think they're gonna make mistakes. You're gonna make mistakes. You want to have that positive relationship with the healthcare professional. Uh, and I'm gonna go back again to say, look, in the real world, and I'm gonna swear, well, I won't swear, but if you annoy someone, we're all human. They might not be that helpful. They might find ways to put barriers up. They might not want to spend as much time discussing with you alternatives or finding the best solution. They might think, oh, here we go. Is this carer again? I'm going to start shouting and blaming. Well, you know what? Instead of spending 20 minutes of time trying to find a solution, I'm only going to spend 8 minutes. Who loses out? Well, I guess we all do, but worse for worse is going to be, the mental health patient. So expressing gratitude for the NHS professional, the mental health professional, when it's appropriate, obviously, thanking them for the time and expertise. This is negotiation. We're talking about the real world here. Failure to try and negotiate, failure to try and build that rapport, I can guarantee 80% they don't want to see you. Um, and they don't want to spend any time. They won't go the extra mile. I'm just trying to be realistic. Again, I'll point back to what I've seen, carers shouting. And I'm thinking to myself, where are they going to end up with this? They will be wasting their time shouting and arguing when all that energy can be put into negotiation. And you know what? It's damaging their own mental well-being. You know, when you're going down that road of shouting and arguing and fussing and fighting, not when it's complaining. If you complain in a way that's productive, I understand. But when it's just shouting and arguing, that says straight away you're risking your own mental well-being. Don't get me wrong, services as it is scarce and it's tricky and it's challenging. So I do understand people can lose their rag, carers can lose their rag. But I'll always sort of say the relationship, even though it takes time, it's better to build that rapport, express gratitude when you can, when it's appropriate, and also be consistent and reliable. If there's care plans, don't just say to your loved one, come off of the thing. It's very dangerous. If it's medication, they should be weaned off the thing. If there's a change, don't just come off. Don't look for alternatives without going through consultations first. Um, check again with a doctor if need be. Follow through on those agreed plans and provide accurate, timely updates about your loved one's condition. Because if it is a plan, if those plans aren't followed, then it's really hard to know what's going wrong. So we're nearly done. Following up on after those discussions. So summarize those decisions and the next steps during or after the conversation to ensure clarity. For example, as mentioned, you've been contacted by email. So, write things down. If they've emailed you, that's great. You've got something to go on. Write things down, what's agreed upon, what your role is. Ask for clarification if you're not sure about your role. If you're thrown into caring for someone with mental ill health, you want to clarify what in this care plan, what do I need to look out for? What's my role? How can I contact you? And it's monitoring those outcomes. After all, if it's a plan of action regarding the care of your loved one, then your main role is to track um, your loved one's progress when if there has been any changes and report back, and I'm sure you will, if things are going fairly well or if they're not, and if any adjustments are needed. It's all about negotiation. It's all about following up and not just coping. And I've mentioned seek support when needed. I mentioned at the start of this that there might be when you're preparing for a meeting, when you're preparing for being invited to a care planning meeting, speak to advocates with those records, obviously with consent of your loved one. They might even ask you, bring an extra family member, a friend, a professional advocate, and I'm talking about an advocate from a care centre or a mental health support centre to important meetings. Even a peer worker is good for additional support. And this is actually going back again to those care centres. They're there. Do reach out to them. Don't put up barriers because of pride or ego to say, look, I'm a strong carer and therefore I know what's best. Because there's a risk taking that approach. The information is there. Learn from those who've been in the game for a long time. So do reach out. There's only so much you can do by yourself. Got care advocacy groups, social workers for advice on negotiation and navigating the healthcare system, especially the mental healthcare system, which I do admit is complex to navigate. This one's not, I mean, I put this in, but it's not something we all have time for. This is just a bonus. And the reason I would sort of go down this route is if you want to prepare literally for those situations, role playing, you more likely again will get this at a care center, to be honest. They might say, okay, look, we've got this meeting coming up. What sort of things do you want to be saying at this meeting? What do you want me to say? So basically, you're practicing negotiation conversations with someone you trust, obviously a carer support worker, or even a friend to build up confidence and refine what you might be asking for. And I think this is really important, no matter if you're making a mess of things. You can always reflect on past discussions. By default, and hopefully by default, you're going to learn from experience. That's why when carers become involved in shaping mental health services, they actually call a carer or patient experts by experience. So there's certain things you're just not going to know. You know, it's a shame. That's how life is. You're learning as you go along most of the time. And I hope what I'm sharing might speed things up for yourselves. But by default, you are learning, even if there's going to be a lot of mistakes. The advantage of this, though, is what you really want to do is identify what's worked and what can be improved. Where did things go wrong? Learn from that experience. So yeah, there'll be situations you're going to be losing your rag, and you can't. A good example: your loved one's relapsing. You say to the professionals, "Listen, my loved one is about to relapse. I need help on early intervention, on crisis management," and they're not listening. So this is the time, really, well, before it gets to that situation, you're going to want to be educating yourself on conflict resolution, staying calm. It's so easy to really start to shout or get angry. You've got to learn to manage those emotions. In fact, it's not learning. There can be situations, if you're lucky, there are mental health trusts that have courses on coping with emotions in this sense. So doing tense discussions, practicing deep breathing is a good one. When people get angry, they tend to hold their breath, or they might actually breathe heavily. Try and ground yourself. Try and be in the present, in the current situation, so you know where you are. Focus on the solutions. I think this can't be all the time, because again, if something goes wrong, then it's your right as a carer to complain, but still focus on the solutions. Don't argue for the hell of it. I've seen it again that there's situations where carers just want to be proven right, and it's not always just about that. If disagreements arise, shift the focus back to achieving the best outcome for the person that you're caring for. So it's not about blame, 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 blame. And remember, there will be, yeah, I do agree there'll be situations where there will be blaming, there will be. But it is all the time is a waste. It's really a waste of energy. It really is. We've got to try and work towards the better outcomes for our loved ones. To sum this all up, um, using these negotiating tips, and there's a lot more to it. I'm just trying to keep this thing short. Carers can effectively navigate discussions with healthcare providers and advocate for their loved one, foster positive and productive relationships that enhance the quality of care. That is your goal. One of your main goal as a carer is to advocate for your loved one and also yourself. And if offered support, feel you don't have to take it, but it doesn't hurt to explore it. There's a reason, really, why people say carers can be hidden, and I'm saying it's not the best situation to be in, to be hidden and to cope and be put under immense pressure while your loved one's health is on the line. So all I'm saying is negotiation is something that might be overlooked, to be honest, but it's worth exploring. And I hope this lecture, even if I think I've not covered half of it, will be of use. Take away what you feel might be useful. Some of it you might feel, oh, it's no good, I've heard it all before, but the rest, it might be useful. We all want to be part of that team, and I think working towards that goal is worth the effort. Anyway, if you felt this lecture was any good, give the video a like, share it with others. I'll try and release more in the future, and subscribe. And lastly, I want to say, do look after yourself if you are caring for someone. If you don't look after yourself, then how on earth Can you look after someone else? Thank you, and I'll see you again soon.